Thank you for joining North Kansas City Hospital's presentation on supplements and nutrition for Alzheimer's and dementia. So today we have Kaci, who is going to be talking to you first, and then we have Stephanie who's going to talk to you second. Kaci is going to touch on the nutrition portion of it, and Stephanie is going to follow up by talking about some of the supplements that are offered. If at any time you have questions, please go ahead and put those in the chat box or the Q&A box. We will answer those questions between each speaker. So with that, I will hand it over to you, Kaci.
Thank you, Shanna. Hi, I'm Kaci. I'm the dietitian here at North Kansas City Hospital. And today we'll be going over the nutrition to help prevent and slow the progression of Alzheimer's. So dementia is multiple different cognitive defects, including memory loss. It's an overall and umbrella term. It includes speech and language changes, cognitive decline, and disturbed in daily functioning. And Alzheimer's is one of the most common dementias. So some characteristics are memory loss, loss of initiative, language issues, lack of self-care, and brain and physical brain changes. So some risk factors that may lead to dementia: obesity, high blood pressure, cholesterol, diabetes, and then low cognitive and physical activities are the high risk factors that can lead to dementia or Alzheimer's. So the big, what we want to do to help manage these risk factors and slow the progression is first is reducing inflammation and managing those risk factors. So following that heart healthy diet, choosing those low inflammation foods, as inflammation and stress are the underlying mechanisms of Alzheimer's. So what we recommend is the MIND diet. It's a mix of the DASH and Mediterranean diet. The DASH diet is a dietary approaches to stop hypertension. It's meant for heart healthy. And the Mediterranean diet is the diet we recommend to the general public. Usually it's based off what people around the Mediterranean Sea eat. And studies shown how Mediterraneans have lower disease rates and they live longer. And the focus on this diet is antioxidants, unsaturated fats, and fruits and vegetables. So first, with fats, it's shown that unsaturated fats help improve brain function and neurotransmission. So that's kind of the wavelengths in your brain. And unsaturated fats include fish, nuts, vegetable oils. So including those in your regular diet, and having nuts as snacks, using vegetable oils as a dressing, or using those to cook rather than butter, which are saturated fats that are shown to increase cognitive decline. So along the lines of fats and oils are nuts and oils. So nuts and oils are high in omega-3 fatty acids, essential fatty acids, and vitamin E. So essential fatty acids are nutrients that we aren't able to make within our body, so we need them through our diet. And omega-3 fatty acids are shown to help reduce that inflammation that can be caused from chronic diseases like obesity, hypertension, high cholesterol, and diabetes. And as I said previously, we're wanting to kind of manage those risk factors to help with slow the progression of dementia. Also with vitamin E is another good nutrient that we touch on multiple times in this presentation that again helps improve cognitive function. One important thing with nuts and oils, they're nutrient dense and they're also energy dense, meaning they have a higher caloric value. And at some stages in dementia, that is good, but while we're trying to be on the more proactive side of things, kind of being cognizant of that. And some ways to add these into your daily diet is adding them as snacks, having almonds or cashews or peanuts, pistachios as just a handful and for a snack. You can add them into your salads. If you like yogurt, adding those in to top your yogurt would be good ways to incorporate that into your diet. Next are vegetables. So all fruits and vegetables are good, healthy. They help reduce risk factors of those previous diseases we talked about. It just shown that green leafy vegetables are in orange and yellow. Fruits and vegetables are some of the more nutrient dense ones that have the nutrients we want to help fight those the cognitive decline. These are high in vitamin A, phytochemicals, which are antioxidants and chemicals in your vegetables that help reduce oxidation, stress, and inflammation, as well as antioxidants. Vitamin A helps fight, again, those oxidation, inflammation, and those green leafy vegetables are also high in vitamin E that we talked about previously that helps improve cognitive function. So it's recommended to have a green leafy vegetable and plus one colorful vegetable daily. And so you can have these if you like eggs, adding some spinach into your eggs, having salads, having smoothies where you can incorporate these different leafy greens. Next are berries. So the some specific to the MIND diet is that it focuses mostly on berries. These are the berries are the ones that have shown only the vegetables that show the to slow cognitive decline. Other fruits are also good, and they help give you fiber and give you vitamins and minerals that you need and help prevent and control those diseases we previously talked about. These are just the ones to show most the slow and cognitive decline. And these are high in antioxidants, so reducing that stress and inflammation, vitamin E. And again, you can incorporate these into breakfasts, as a side, add it to your yogurt, make a parfait, having them as snacks, just having any blueberries, strawberries, raspberries, adding them in as snacks, and you can add them in as salads. A question I get frequently is, should you get fresh, frozen, canned? They're all a good source of vitamins and minerals. If you frozen is just as good as canned. Frozen is just as good as fresh, and they last longer. I know that can be an issue because fresh produce can go bad quickly. And canned, if you want to get canned fruits and vegetables, get them in 100% juice or canned in water, just to have that lower sugar content of them. And then whole grains. So whole grains are high in B vitamins, vitamin E, and fiber. Whole grains are found in your whole grain bread, pastas, brown rice, things like quinoa. Whole grains are also great with the glucose management. They help slow the increase of your blood sugar after meals. So that again will help with those managing your diabetes and other things that can progress Alzheimer's. And they're also heart healthy to help lower your cholesterol and hypertension. And these B vitamins, they also provide increased neurotransmission as well. So again, some more vitamins that we're wanting to help with our brain. Okay, fish and poultry. We discussed this a little bit of these importance of this with our fat slide. Fish and poultry, they're high in omega-3s, those that fatty acids that are good to help reduce inflammation, and again, vitamin D that's help with neurotransmission. Some tips with adding fish and poultry: choosing skinless, that'll reduce the amount of saturated fat you're intaking. And then you can have a chicken or tuna salad on whole grain bread to incorporate those whole grains. Having chicken tacos, so chicken or fish tacos, you can have the good healthy lean meat, and then adding in spinach or those leafy greens, and having maybe some peppers with that too, to incorporate all the things we previously talked about here. So we kind of just talked about everything that we want to make sure we're getting more of, increase. And these are the things we're kind of wanting more moderate intake. These have shown to increase risk of cognitive decline, as well as those diseases we talked about before, cardiovascular disease, hypertension, and diabetes. So we want to moderate those saturated and trans fats that are found in animal fats, butter, a lot of your pastries and processed foods, as well as simple sugars. So those are in your sodas, your candies, your white breads, your sodium and fried foods, which are again found in a lot of takeout fast foods and things like that. And it's not saying that you can never have these again, or if you eat these, you're for sure gonna decline, but just having a moderate intake. So about 2 to 3 times per week is what we recommend. So there's multiple complications of dementia, and Stephanie will be touching on this as well. I just was going to point out some of the key things about nutrition. So with dementia, a lot of times our loved ones are forgetting to eat, having swallowing issues, change of sense of smell and taste, which can lead to malnutrition due to not wanting to eat or not enjoying eating. And this can lead to weight loss, aspiration, and need a modified diet, which Stephanie will be touching on today after this presentation, dehydration, and poor nutritional status. So things we can do to help combat that poor appetite and weight loss is making sure you're eating small, frequent meals about 4 to 6 times a day, eating your high protein foods first at meals, because those give you more energy and more strength. And then also incorporating those high calorie foods. So previously we said kind of watching how much you're eating, and that's still important, but just making sure you're getting those nuts, oil, seeds, as those are more energy dense. Eat whenever your appetite's best. Drinking fluids between meals. When you're drinking fluids during your meals, that can kind of fill you up quicker and you eat less. So if we're wanting to prevent weight loss and encourage your appetite, having those in between meals, adding gravies and sausage to meat and poultry and sauces, and side dishes just to have some extra calories, and then sipping on some beverages that provide some calories as well. So with taste changes, we want to start with foods that are more bland, and then add flavor, and then also trying colder foods first, since hot foods tend to have a stronger taste. So if tastes are altered, they can be more intense. And then adding seasonings to help flavor your foods. Sometimes our patients' tastes are a little bit metallic, so recommend eating with plastic utensils, and just good oral care. And then Stephanie will again be talking about nutritional supplements, just recommending them 1 to 2 times a day just to get some more calories and protein. And then hydration. Aging in general increase the risk for dehydration, and sometimes if the water's not in front of us, we're not thinking about drinking. So, and as we age, our sense of thirst declines as well. So just some ways to help maintain fluids is always carry a water bottle, having water in front of you, using a straw if swallow allows. And this just helps increase your energy and keeps you hydrated. All right, that's all. Do you have any questions for me?
Thank you. I actually have some questions for you. So while we are maybe waiting for other people to ask questions, I'm going to go ahead and ask a few of mine, okay? Okay. So the first one that I have for you is the word diet. So I know I hear this word used a lot, And it's typically with people saying, I'm going to do the bone broth diet, or I'm going to do the Whole30 diet. So is your recommendations, are those something that people can just do for a short amount of time like we typically do diets?
That's a great question. And when I'm using the term diet, I mean kind of the diet we're eating. So it's more of a lifestyle. So this would be a long-term lifestyle, kind of making sure you're always incorporating those fruits and vegetables, those whole grains. And diet can be is typically a term when people use for the short-term nutrition regimen. However, with these diets I'm discussing, is a long-term lifestyle.
Okay, so the longer the better, right?
Correct.
Okay. Another question that I have for you real quick, and Stephanie, if you want to go ahead and throw your presentation up on the screen, that would be great. So the word, well, you had mentioned protein. Is there a certain time that we should be avoiding protein, or certain of the foods that you had mentioned for medication, or is it, do you know if it's something that we should be looking at?
Yes, so there are some certain foods that do interact with medications, but that is varying per patient and per medication list. So either talking with your doctor before, kind of telling them what you're eating, or kind of what your medication is, and they should inform you on, because a lot of medications you can't have grapefruits with. So just being transparent with your doctor, that will help as well.
Okay. Kaci, I don't know that we have any other questions for you. If you guys happen to come up with questions for Kaci as we go, please feel free to either reach back out to me, or you can throw them up in the chat in the Q&A, and I can have Kaci answer them, and I will get back to you. So Kaci, thank you so much.
Thank you.
All right, Stephanie.
All right.
I think it's your turn.
It's my turn. Okay. My name's Stephanie. I am a speech language pathologist. And so Kaci did an excellent job. I love that presentation of, talking about what we need to eat to help keep our mind and our body strong and sharp. I'm going to start off by talking about how we need to eat to make sure that swallowing is safe. So let's see if it's going to listen. Here we go. So my plan today is to talk about swallowing and dementia first, kind of going into dysphagia, or that swallowing impairment that Kaci mentioned that can start to develop over time, and then ending with some different supplements and medication questions that I get a lot in my practice from my patients. So just answering some of those frequently asked questions, and then we will get into any of your questions if you have them. So I think that to start out, just thinking about the connection between swallowing and dementia, it's important to know that your brain controls all of the muscles and the functions of our body. So when we start to lose those brain cells, different functions can be affected. And typically with dementia, we see a weak swallow, we see a discoordinated swallow, we see difficulty with chewing, or maybe difficulty recognizing the food or understanding what to do with the food. Sometimes we see difficulty using a straw. People might just bite down on it and not realize that they have to suck to get the liquid up. And, there's a lot of different things that we might see either in the hospital or as an outpatient that people are struggling with as the disease progresses. And I think it's important to recognize that swallowing problems actually happen in about 45% of those people with Alzheimer's and other dementia, so at least half. And that number does increase as the severity of the disease progresses, with some degree of dysphagia actually being found in close to 80% of elderly who are in a nursing home diagnosed with dementia. So this is a very, very common issue. And I think that understanding how swallowing works and what can help, can just really help increase the quality of life for these patients and our loved ones, and just make sure we're doing all we can to help keep that nutrition up. So why does the swallow change with dementia? Well, there's multiple causes actually. So they may lose interest in eating or drinking or develop swallowing problems because of physical issues. So maybe they can't hold their utensil properly. Maybe they have difficulty maintaining their posture during meals and they kind of start to slump over to the side. Maybe they just have weakness. I often tell my patients sometimes eating a meal can feel like a marathon because we are working hard. Our muscles work very hard during that. Some people also have tremors, which can also make feeding difficult. You might have sensory problems, so difficulty recognizing food, difficulty gauging the temperature of food. Oftentimes people have a reduced sensation, as Kaci said, of hunger or thirst, so they don't even realize that they haven't eaten all day or that they haven't drank anything. Environmental problems might be things like too much stimulation. Maybe the environment is too loud, too bright, and it's making them lose their attention, their focus on the meal at hand. Maybe they're cold. Maybe there's an unpleasant odor. So things in the environment can certainly impact them. Oral hygiene, as Kaci said, this is super important, keeping the mouth nice and clean and happy. If your mouth is, really dry, if you have maybe ulcers in your mouth, your teeth are in bad condition, or maybe you have missing or ill-fitting dentures, that's going to make you not feel very comfortable during a meal. So you might just not want to eat at all. Medications can also impact appetite and a person's ability to swallow effectively. Communication and cognitive issues. Sometimes, people can't express their preferences for foods, so they're, getting foods that they don't necessarily like. They have difficulty following directions during a meal, or they have difficulty remembering to eat, as we said. And then finally, dysphagia, which we're going to get into here next. So all of these problems can make meal times feel very frustrating and stressful for caregivers. And so I think it's important to remember that dementia does vary from person to person, and problems might look different for your loved one, depending on what stage of dementia they're in, but there are some things that we can do to help. So let's dive in a little bit into the concept of dysphagia. And that is the term for difficulty swallowing. And nearly 20% of all adults have difficulty swallowing. Actually, 3 million cases are reported per year. So I've got a little clip here of a normal swallow on the left. So you see that with a normal swallow, the airway, the trachea is closed off. The food or liquid goes down the esophagus into the stomach where it's supposed to be. When you have dysphagia, you may have a weakness in your swallow muscle, so that airway isn't closed off as tightly. So you might have food or liquid going down the airway into the lungs, which you can imagine is quite dangerous. You can develop aspiration pneumonia and have some pretty uncomfortable meals if that is happening. So what are some signs of dysphagia? You might notice people coughing, choking. They might have a wet or gurgly voice. They might have shortness of breath during a meal. They might feel like things are getting stuck in their throat. They might have difficulty chewing, which might lead to spitting out of food or holding food in the mouth. And they might have avoidances or foods that they absolutely just refuse to eat because it's too uncomfortable. And again, if you're having something going down in the lungs besides air, that can definitely lead to some pretty gnarly upper respiratory infections, which is what we absolutely do not want to see. You can see the chest X-ray on the left has some infiltrates there. That's what the doctors typically look for when they're consulting us to check someone's swallow. You might see poor nutrition hydration because the person just doesn't feel comfortable at meals, so they stop eating. that can lead to weight loss. And then of course, if someone's chronically not eating well or drinking enough, or they're getting these recurrent respiratory infections, it can lead to death. So this is a very serious issue, and it's one that we want to stay on top of. So how can we help? Some tips and tricks to maximize nutrition. So thinking about positioning, making sure the person is comfortable, they're sitting upright, preferably not in bed if possible. If the person's head tilts backwards, try to help move it to a more forward position. And to help with digestion, you definitely want to keep that person up for at least 30 minutes after their meal. Laying down right away can increase the risk for reflux. We want to minimize distractions, so trying to serve meals in a quiet surrounding, away from the television, avoid placing a bunch of unrelated items on the table that might distract or confuse someone. There are safe feeding and swallowing strategies, which I will go into here in a little bit. You can also get some adaptive equipment if someone's having trouble feeding themselves. There are forks and utensils that are weighted if they have tremors, or maybe they're built up a little so they're easier to hold. You might serve finger food so the patient can feed themselves, or your loved one can feed themselves without having to use a utensil. You might provide some cues, so visual cues, verbal prompting. You might, have someone smell the food and talk about how good it is, going to be. And really thinking about ways that we can, pump up meal times a little bit, get the, enthusiasm there. And then I would say our last resort is diet modification. So typically we like to keep people on a, quote, as normal a diet as possible for as long as we can. Sometimes it is necessary for safety reasons to change the consistency of the diet, so making things a little bit easier to chew or thickening the liquid so they move a little slower. But we try to make sure we maintain the look of a normal diet as much as possible, again, because I think, those visual cues, if it's going to look more appetizing, the person's going to want to eat it. So we try to take all of that into consideration. So I think this picture illustrates something really important. A study conducted by Boston University actually found that patients who ate off red plates consumed 25% more food than people who ate on white plates. Now, why is that? It's because if you can't see it, you're not going to eat it. So making sure that you have some high contrast colors on the table so the person can see what they're eating. Color helps to stimulate interest in people with dementia. If the food is too close to the color palette of the plate, they might not even know where it is. So you might want to experiment with different sizes, textures, flavors of food to see what the person responds to best. And then let's look at the environment here. So looking at this picture, I think this is something we all can recognize from a typical nursing home, but there's a lot going on here. So first of all, it's probably pretty loud. It looks pretty busy. There's a lot of people. There's no dining cues. So we don't see anything that indicates this is a dining room other than the table. There's also people just kind of standing around not eating. So I think for a person with dementia, this situation would be pretty overwhelming. As opposed to this picture, which illustrates an ideal kind of dining situation. So you have a place that's quiet. There's not a lot of seats around the table. You have some plates and glasses in a nice cabinet. So it looks like a dining room. You have high contrast colors of plates against the table or the placemat there. So they can see it. You have a piano, so maybe somebody can play some quiet, relaxing music, and you have lots of natural light so people can see a little bit easier. So thinking about that diet modification, again, this is kind of a last resort, but sometimes with the solid food, we have to make it easier to swallow. So we have different levels of solid foods. So going from regular to soft to ground to all the way blended, which is more like a puree consistency. Liquids may need to be thickened. You can see down at the bottom, the liquid on the left is regular, so it spills everywhere and it goes really fast. That's what it's doing in your throat. When you swallow, it dumps down really fast, and if your muscles are not coordinated enough, it could dump down in your airway. So by thickening the liquids, making it go slower, just like the liquids on the right, it still gives the same amount of hydration and the same amount of liquid. It just makes it a little safer for some people to swallow. Again, I try not to do this unless it's absolutely necessary, just because dehydration is an issue. If people don't like the thickened liquids, they're less likely to drink them. This is an example of kind of our diet levels that you might see. And then thinking about some, strategies that you can do to help swallow safety. So thinking about alternating bites and sips, making sure that all the food is out of their mouth before offering or, cueing them to take another bite, making sure they're not getting a bunch of food stuck in their mouth, feeding them or having them take their meals when they're most alert or attentive, maybe smaller meals throughout the day, instead of 3 larger meals, making sure they have good oral care, dentures are clean, in properly, will make it a lot more comfortable. And again, going back to those diet modifications and feeding tubes is actually a question that I get quite a bit. I think it all comes down to quality of life. So I think first and foremost, we need to remember that regardless of a dementia diagnosis, every individual deserves to dine with dignity. So thinking about our life is so tied to meals and socializing around meals and cooking, preparing meals, that when you take that away, a huge piece of your quality of life can be taken away. So again, I really hesitate to make modifications unless they're absolutely necessary. When it comes to feeding tubes, research shows that having a PEG tube, a tube in the stomach that gives feeding directly to the person, does not improve patient outcomes or quality of life in those patients with advanced dementia. Really, we're really only looking for maybe short-term measures to help someone recover from an acute illness, such as a urinary tract infection, and sometimes they can do that through a feeding tube in the nose. But a long-term feeding tube in the stomach is really not advised for those patients with dementia. What we should do instead is enhancing the oral feeding environment, really doing, person-centered feeding, so paying attention to what that person is telling us, both in their words and their actions. And really just using those strategies to make feeding as safe as possible. Those strategies have been shown in research to be as good as tube feeding for the outcomes of these patients. And then some of the things as a speech pathologist, when I evaluate someone swallowing, there are some things I keep in mind. So, somebody who has really good oral health, they, maybe aspirate occasionally, but their immune system's really good. Their risk of pneumonia is quite low. So I probably am not going to change their diet. Whereas somebody who has really poor oral health, they are aspirating and they have a reduced or compromised immune system, they have a high risk of pneumonia. So we might need to make some changes to keep them safe. But this is kind of the balancing act that we do as clinicians. And I think as a family member, it's important to ask lots of questions and kind of hear the clinician out, what they're recommending, and then, coming to a solution together. Another thing we sometimes do is what we call a free water protocol, where even if somebody is aspirating liquids, it's going down the wrong way, we will allow them to have free water in between meals. Again, because with thickened liquids, people drink less, there's more of a risk of dehydration. So allowing someone to drink water in between meals where it's less risky for them can sometimes help improve hydration and quality of life. So it is quite the balancing act, but we do our best to try to help balance safety and quality of life. So talking about some medications and supplements, again, these are some of the frequently asked questions that I get in my practice. When we think about prescription medication for Alzheimer's and dementia, the drugs typically fall into two categories. The first category is a drug that may change the disease progression, and that drug is called, and I apologize, I'm terrible with pronouncing these medications, but aducanumab or Aduhelm is the brand name. This is the only medication right now. It's actually an IV infusion therapy that's approved for Alzheimer's disease. It has been shown to remove amyloid, which is the plaque that people with Alzheimer's have shown on their brain in brain scans. And research shows it is reasonably likely to reduce cognitive and functional decline in people living with early Alzheimer's. So that one is one that can help actually change the disease progression. It's relatively new. The other class of drugs temporarily mitigate some of the symptoms of Alzheimer's disease. So they're not treating the disease itself, they're just addressing the symptoms. I like to tell people they're kind of making the parts of the brain that are work better, but they can't help the parts of the brain that are no longer working. So those are the cholinesterase inhibitors like Aricept, Exelon, Razidine, the glutamate regulators like Namenda, and then you might have a combination of the two, which the brand name for that is Mamzerek. So anybody who has a family member who has Alzheimer's dementia, these medications probably are pretty familiar to you. Your doctor also may prescribe something like an antidepressant because that can also be kind of an underlying factor in individuals that have dementia. People that have, what they call behavioral and psychological symptoms of dementia, like increased aggression, anxiety, wandering, sometimes antipsychotic medicines will be prescribed. However, coping strategies are excellent to try first, and we'll talk about those in just a moment. And then kind of thinking about the person as a whole, we want to manage other health conditions such as heart disease and diabetes. As we were told before, these are definitely contributing factors to cognitive decline. So we want to make sure that those are absolutely taken care of. I did a quick internet search on supplements for brain health. This was literally just the first, I think 10 or so things that popped up. But nowadays, there are so many supplements on the market. I think the most recent statistic that I read was that 80% of Americans use supplements, from treating acne to treating dementia. And I think this is the area that I get the most questions on. So let me just give you a little bit of advice. I think it's important to remember that supplements are not regulated like prescription drugs are. So as long as these companies put a disclaimer on their product saying that it has not been evaluated by the FDA, they can say that it does anything they want. I think that it's really unfortunate because I think people are looking for a quick fix. But generally with this, there really is not a quick fix. And you're probably better off just with a nice multivitamin and not paying that markup price for something that is, quote, for the brain. Online health scams have increased 20 to 50% in the last few years. And if anybody does any kind of social media, you know that there are definitely advertising and algorithms. If you click on something or you search for something, you're more likely to see an ad for that topic. And so you're going to be seeing a lot more of that. And then you think about all of these celebrities who endorse specific things. I think it's important to remember they have nothing to do with the product themselves. They are just marketing affiliates. They have nothing to do with the quality of the product. Supplements also can have side effects with medications. So it's really, really, really important to ask the doctor. It's good to look for that seal of the US Pharmacopoeia, USP, or the NSF International that review the tests, and you can find those on consumerlab.com, but a few signs over there on the right that this is a supplement that's more of a scam. Things that promise fast results or miracle cures, things that are celebrity endorsed, a product that's in short supply or not available anywhere else, things that have money back guarantees, free samples, and only animal studies. So just be aware. There's also a lot of talk about different supplements, things like ginkgo biloba, vitamin E, curcumin, vitamin B, omega-3 fatty acid supplements. I think in general, I've reviewed a lot of the research on this, and all of them really just have inconsistent results or very small sample sizes. So it's not something that we can generalize to the population as a whole. I think it's safe to say that people will continue to develop products and supplements, and there will be continued research. So I look forward to the day where something comes out where they're, they have good research behind it, and they can really show the effectiveness of this product. But until then, I really just steer people away from doing crazy supplemental regimens, especially without the oversight of a physician, because we really just don't have the research to back it up. Some of the things that I recommend instead, because they do not require medication, are things like walking and physical activity. Keeping your body strong is going to keep your swallowing strong. It's going to build an appetite. It's going to help keep the person active, and that's going to just help them overall. I tell people your swallow is a reflection of the rest of the muscles in your body. So if your body is strong, your swallow can be strong as well. Cognitive therapy can help just keep someone active again mentally. We do reminiscent therapy with patients that have a more advanced dementia. So we do things where we reminisce about the past and meet the person where they are in their disease process. And a lot of times this can help lead to improved quality of life and also improved behaviors around meal times. So there's not a lot of fighting or coercing in meal times, because that person is a lot more content. And then finally, music therapy has also been shown to help just with overall dementia behaviors. And again, maybe some quiet, calming, relaxing music at meals can really help bring up good memories and keep that person happy. So I have some resources here. So I think North Kansas City Hospital, we're definitely always here to help support our patients. The National Institute on Aging is a great resource center for disease control and prevention. And again, if someone is worried about their loved one, if they feel like their swallowing is not safe, or if they would like, to have an evaluation done, therapy is covered with a doctor's order. So our rehabilitation department number is right down there. And then finally, I will leave you with my contact information. You can reach me, and if you have any questions that you don't want to ask on here, but if you do, I will open it up for questions at this time.
Thank you, Stephanie. And I know that we have just a couple of minutes, so I wanted to point out, I really thought it was interesting, the color of the food versus the color of the plate for
Yes.
eating. We think that we're getting plates because we think they're pretty or they match what our interior is, but not about how the food is going to look on them.
Right. And it's such a simple thing that you can do to change the color of the plate. And if it's going to help increase their, eating, I think that Boston study was 25% more if you had a red plate. And I think that's such an easy thing for us to do that, I think it's those simple, quick fixes that we can make a big difference sometimes.
So then would the 3 be the same if I decide to serve a meal that has lots of different colors in it? Would that?
Oh, absolutely. Yeah. I think, varying the, color of the food, the taste of the food, the temperature of the food, the texture of the food, it can keep people engaged. So they're not just eating like a bowl of oatmeal and that's it. It's like, you're getting a lot of sensory input from the food. So it's keeping them not only engaged, but also probably more nutritionally balanced.
Got it.
Yeah.
You had mentioned hydration being a concern several times.
Mhm.
How do you feel about eating maybe some fruit that is more dense in hydration, such as watermelon?
I think for our patients that just have, maybe a normal swallow, but maybe we're concerned about hydration, I think those fruits are great. I think, again, I would kind of go back to choosing foods that are fruits, if they are in a can, that have, the no added sugars, to keep that down. If someone does have an issue with swallowing and we're concerned about them aspirating thin liquids, we will kind of guide them away from some of those fruits just because they have an increased risk. But typically, a lot of times we just have them drain off the excess liquid and then they're good to go.
Okay. All right, Stephanie, it doesn't look like there's any other questions. I thank you so much for talking to us today.
Yes, thank you guys.
All right, you have a good day.